What is the benefit that might come from this therapy for this certain group of women?
Harry, women who've been entering menopause have been afraid to take hormones because a huge study years ago showed dangerous side effects. Now, today's study looked at certain women in that study, just women who had had hysterectomy. That's 1 in 4 women in the United States. And they gave them just estrogen for an average of about 6 years. Now, there was some good news, okay? Across the board, there was about a 23% reduction in the risk of breast cancer. That was ages 50 to 79.
What about the other side effects, though? Because one of the things that's talked about so often is heart disease.
That's absolutely right, okay? And what they found was that the risk depended on the age of the women. So in the 50s and to 59 group, they had a decreased risk of breast cancer, but also a decreased risk of heart attack and a decreased risk of death.
Wow.
Now, they did have an increased risk of clots of the lung.
All right. The other question that is sort of weighing us tonight about older women in their 60s and 70s. Is there anything we can take away from this study?
Well, it turned out that women in their 60s had that lower risk of breast cancer, but they did have no significant change in heart attack or death. And there was a problem for women in their 70s, okay? They had, again, the lower risk of breast cancer, but there was an increased risk of death and an increased risk of heart attack. So where does this leave us all, okay?
Right.
Most women who are entering menopause are in their early 50s, and those are the women who are considering taking hormones. So for those people, if they've had a hysterectomy, then they can consider taking estrogen only. But again, this is one of those things, we say it all the time, where they have to talk to their doctor about the potential risks and benefits and personalize it.
Dr. Jon LaPook, thanks so much.